Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. So, as we sit here now and you think about crafting an adaptive response for when, maybe this thought returns, right? So oftentimes these automatic thoughts kind of cycle. And you see the same one over and over, right?
Yeah. Mm-hmm.
So my guess is that as other places you've gone, you've had that same or similar thought.
Yes.
What adaptive response could we create together that could attack that automatic thought?
I guess I could say that. I am pretty confident that we locked the door and, that the house is secure so that there's no one in the house. But, if there was, maybe, if that did happen, that we would handle it just like we did with the first time.
Okay. So, it's unlikely
Right.
somebody's in the house because we locked it.
Right.
However, in the worst case scenario, if someone was, that would be awful, but we would survive and actually do okay.
Yeah.
Because we did before.
Right.
How much do you believe that adaptive response?
Now?
Mm-hmm.
I think I'm fairly confident.
That that's true?
That's true, yeah. I think that would be a likely outcome. That we would be okay if it happened. That it would really stink, but that we could get through it.
And that's a really good point about adaptive responses. They have a realism to them.
Yeah.
Right? So as you create these, don't think that they have to be all positive and good.
I will never get robbed again.
Right.
No, yeah.
Yeah, unrealistic adaptive responses don't help us as much. It's
That makes
okay to
sense.
say, very good actually to say, yeah, that would be awful, and it would be inconvenient,
Yeah.
and what a hassle.
Yeah.
However, it's unlikely, and if it did happen, we'd survive.
Okay.
So you're willing, in cognitive therapy, you're willing to really look at the situation realistically, the good and the bad, and put that together in the adaptive response.
Okay.
The key feature of the adaptive response is that it's realistic, and oftentimes automatic thoughts really expand on the dangers.
Yeah.
They're usually unrealistic.
I'm glad you said that, because what I was trying, and why, I decided to come into counseling, is because I was trying to just tell myself, oh, well, that couldn't happen. Your car's okay. Just a very blanket statement, oh, you're crazy, that would never happen, sort of thing. And then I was, in my mind, was easily able to refute that and say, well, it did happen. So I was having this, dialogue inside my head, and when I was just telling myself, oh, don't worry, it wasn't successful at all, and now I see why, that, it's okay to be realistic and say, well, it could happen, but then I would get through it, as opposed to just saying, oh, that would never happen again, because it did. So it wasn't a very powerful, self-talk.
You were easily able to challenge that self-talk.
Yeah, exactly. It wasn't helpful at all. So, now I see why it wasn't helpful, because it wasn't realistic, that I would just say, oh, this would never happen to me again, or something like that. It's so easy to say, oh, well, don't worry. People say, my husband or other people say, oh, don't worry about it. Well, I had a very real thing happen to me, so a realistic adaptive response, like you're saying, is, I think, a lot easier to believe than something that's completely, too hard to believe.
Absolutely. Yeah, it's very much so okay to be realistic. When we craft these responses, we really want them to be legitimately something we can believe.
Yeah.
Right? The adaptive responses have to be believable. And that means that, some of them contain pieces that may not relieve all the anxiety, like when you admit that it could happen again.
Right.
It's a little anxiety provoking, but at the same time, by accepting that that could happen again, you're really taking the power away.
Yeah.
Right? If you're okay with, like I mentioned before, if you're okay with the worst possible outcome, that's really the ultimate protection against anxiety.
I think I was thinking, like, I just need to get over it and just be not anxious at all, but I feel like, and then the guilt that comes with, not getting over it so quickly when other people or I tell myself that I should, that it's okay to kind of live in that low anxiety for now, since it was somewhat recent, so we can kind of get through it.